This is Leon with CSS. We are so happy to have everyone at this first CHA meeting. We had such an exciting time up in Albany. It was great to, take pictures of everyone and, get your questions and, just be together as a team. And that's one of the things we're going to be stressing here as a CHA network, that we're a team. You don't have to feel that you have to do this by yourself. You can always reach out to one of the specialists. You can reach out here to us here at CSS, and we're going to do our best to give you the information that you need so we can help our clients in the community. And talking about helping clients, one of the ways that we keep track of that is that we use the CHA database. And by now, everyone should have received a login and a password for the CHA database, and there's also a training mode that I sent out information on. So if you just want to play around with it and familiarize yourself with the CHA database, you can use the training mode login information. We have two distinguished staff members with us today. They've been preparing for this presentation for a very long time, and they are super excited to be with us here today. We have Steffi Kinglake and Emily Clark. They are going to be our presenters today for the CHA database. So at this point, I'm going to turn it over to them. I just wanted to mention that in terms of if you do have questions, please type in your questions, and we're going to address all the questions at the end of the presentation. So yet again, good morning, and welcome to our first CHA meeting. We are super excited to have every advocate on the line with us here today. And at this point, I'm going to turn you over to Steffi and Emily.
Good morning, everyone. This is Steffi. Just before I start, I am the volunteer manager here at CHA and oversee our volunteer program, and through that get a lot of feedback about the database and looking and reviewing the work that the volunteers do on the helpline, and have been involved in some of the other aspects of the CHA program, including our communications and developing some of our one-pagers. And so I was really pleased that Nora and Leon invited me to do this training. I think it's a really important part of the program. And I didn't realize we were starting off our webinar series with it, but it's great. And I'm here with Emily.
Hi, I'm Emily Clark. I'm a health counselor here, and I have a lot of experience using the database and understanding, the challenges and questions that will come up along the way. So hopefully this training will be useful in, sort of guiding you into an introduction on how to use it.
And this training is really just to go through the basics. And so it's going to be short, and the idea is that as you get to know the database, that we can maybe do a follow-up training that goes more, in-depth about the questions after you've had some experience with it. But this is really just to give an overview and sort of a general orientation. It's my understanding that you all received the manual last week, and so that should really be what you're using when you're going through the database and practicing, and if you have questions when you're doing, filling in information with your clients. This is not going to go as in-depth as the manual does. It's really just to walk you through some examples and some of the, sort of overarching themes of the database. Hold on, sorry. Our computer is thinking. Okay. So a basic question is, why do we need the CHA database? And, I think there's many reasons, but to sort of highlight the two real reasons is that we use the database to help us figure out what's going on with health insurance in New York State and what people's, overall sort of access to healthcare services are and different trends. And through the database, we can pull data and be able to run reports and identify the different needs and trends that statewide. It's a tool that we have as a statewide network, and the number of cases that are being entered, that it's a really powerful tool to help with that other function of the Community Health Advocates program. It helps us to understand who our clients are and what services people need from our program and what they're using our program for. that can help us both in understanding the successes of our program, but also figuring out who we're not seeing and who we need to be doing more outreach and community contacts and communication with. So that's a really important function of the database. Another obvious one is with fundraising. We use the reports and we include data in all of our grant proposals as well as final reports to the different agencies that give us funding. It shows both the work that we have done and also that we need funds to do more work or expand the network or address different kinds of issues or create different materials. Why is this not? Okay. Here's just an example of some of the charts that we pull from the data that's in the database. And again, it helps us. These two charts in particular help us understand who's coming and receiving CHA services. So we see by language, that's one of the questions in the database, and also household income. This is really helpful for our fundraising efforts and also for identifying trends when we meet with legislative agencies and offices. We can also demonstrate what population we're serving with the program. Here's another kind of chart that just shows the different needs that are reflected in the database. And we can see during this time last year, there were a lot of people calling who were about needing coverage. As you know, the CHA program is changing. We're now, and the insurance world is changing. We're now in a post-enrollment world. And so we are working to make sure that the needs best reflect our clients' needs. And so things might change a little bit in the database as we start this new year. And we will communicate all of those changes as soon as they get done. So just keep an eye out if there's little changes in the definitions of needs or different drop-down menus. Some examples of the trends and what we've been able to use the database for, and I'm going to highlight the first one. There was a really sharp increase in calls coming from Empire clients relating to billing and appeals and coverage denials and assessing specialists, and using that data and information from the database, we were able to draft a letter to DFS and the New York State of Health saying and highlighting a lot of the problems that consumers were experiencing with Empire. And that really brought about significant change. Empire was informed of their, the different issues that individuals were experiencing with their product. And it showed how, because we had enough information in the database, that we could show that it was a real trend on a statewide level. There are two other examples I'm just included here. But again, the wealth of sort of just the pure sake of the numbers in the database can really help us make significant policy changes with both private health insurance plans and sort of systematic issues that come up in the state. So the key, as shown in the different charts, is that the information we have is only as good as the information entered. So it's really important that for each case we're accurately reflecting the work that we've done, as well as the demographics of the individual and the different needs that are presented in that case. I think a lot of you are new to the program, so for those who have already worked with the database, this might seem very simple, but I think it's important to start at the basics. The database is used by agencies for two different reasons. There's the case handling section and then the community presentation section. This training focuses much more on the case handling section. And to begin, the database has 3 levels. So there's the client. So, Mr. Andrew or, Miss Sue is a client of CHA. Then there's the case file. So Mr. Andrew might have called us or been a client at one point for a certain issue, and that's a case, and then maybe a couple of months from now or a year from now he calls again or she comes in again and has another case with the agency. So within the client file, we're able to have different cases for that particular client. And then there's the needs and services and the case notes, which go with each of those individual cases. So it's really a three-tiered system, and it's a nice way to think about it when you're looking at different screens in the database and trying to figure out how to access what section for a particular individual that's coming to see, for our services to come and see you. This is just a list that's of really basic things that are important to remember when you're entering information into the database or when you're exploring it. The asterisks are required fields. Sometimes, for example, when you're opening a case, fields might not be required, but then when you're closing case, they become required fields, and that's the point at the very bottom. So the case, you won't be able to go to the next screen unless you fill out that asterisk, that required field. It's really important to double check names of clients when you enter it. That makes it easier to find a client again if they come back to you or if you're working on their case. It also prevents duplications. So a lot of times there might be an error when someone's called and then they call again and you're not able to find that client in the database because the person has misspelled their name. So it's a really basic thing, but I can't emphasize, again, how important that is. Making sure that we get contact information that's entered correctly. And this is for two reasons. One, because you obviously need to get in touch with the client. But two, it's helpful to have more than one kind of contact information because phone numbers go out of service or people aren't able to pay their bills or they move. And you want to have a way that you can contact the client, whether it's by mail or on the phone, if one or the other is not working. So, making sure that that's entered correctly as well. The marketplace versus non-marketplace plans. So now the drop-down menus include this distinction, and it is important because as part of our trends and tracking, we're really going to be looking at what people's experiences are with, both marketplace and non-marketplace plans, sort of in this new time of health insurance. Recording all the issues and services provided for the case. So we're going to go more in depth about this when we do some of the examples, but let's not sort of sell ourselves short, so to say, in the work that we're doing. And the more that we indicate of what we've done for a client, the more we can demonstrate the time and the complexity of a lot of the cases that we're working on. And so that's important. Often we're just clicking one or two of the issues, and it might be that several issues have come up for that particular client. The case notes, and I think this is outlined in the policy and procedures, but that we really need to have as much information as possible in the case notes. It becomes kind of the record of the work that has been done on the case. It's also important because if anything ever comes up and you're not able to be in the office and a client is contacting you because of an emergency or something happens, it's where case handlers and supervisors often look to see what the next steps or what actions have been taken on the case. So it's important to, when you're closing a case, to really explain the exact actions that you took and what the outcome of the case has been. I think it's also really helpful to use the case notes to keep a really accurate account of the different people that you've called in relation to the case, whether it's calling health plans or the Social Security Administration or the local district Office of Social Services. And we're, tracking the phone numbers and the different names and dates. And, you'll be able to see that if you have really fleshed out case notes, that it makes the case handling work a lot easier. you're able to refer back to that section in detail when moving forward with the advocacy work that you're doing. This is in the manual, and I just think it's helpful to have here too. There's, certain ways that information needs to be entered into the database, particularly with the sort of numeric, the number-sensitive fields. And it just, if you know this off the bat, it facilitates and makes it a lot faster for you to get through the different sections of the database. So I just wanted to have a slide about this too, and so there's 2 places of reference. So this is the address of the database, and I think we're just going to go into it. Let's hope this laptop works with me. And I am going to enter in as the training mode that you guys have all been told about. But here you get a sense of the different drop-downs, and your agency should be included there. And that's where you select the agency. Leon mentions that you're given a username and a password. TBN, right? TRN. TRN. Sorry. TRN. And then you log in. Sometimes it takes a little, depending on your server, a little bit longer to upload. But this is the initial screen of the database. And I think for this section, I'm just going to really walk through some of the different screens in different sections, and then Emily is going to do some some examples so you can find, you can see that more in depth. But the ones that you're really using the most is this create or search a client and community presentations. The create and search a client is pretty obvious, and if we click on it, this is where you can look to see if you're working on a case. It's an easy way to find the case that you're working on, and again, this is why the spelling of the last name and first name is really important. So you can find clients this way. The phone number is often a really good way to do that if you want to, if you think there might be a misspelling when the case was entered. And then to add a client, you just click on this button. So I'm not going to enter lots of information here, but I'm just going to go through some of the areas. I think an important one to note is that you always can anonymize a client, and some clients don't want their information to be shared, and so there is more information about that in the manual, but I just wanted to point it out that it's it's the first thing that comes up when you're adding a client. This is where contact information, so you can see right now that primary phone number is not a required field, but I really do emphasize completing that and putting information there. And you can identify here what type of phone number it is. Most people only have mobile phones now. The email and address lines are also not required, but it's really helpful to fill those out now. And if a client is homeless, there is a box here to indicate that as well. Here's some of the really basic demographic information. There's different choices here, and there'll probably be a training about sort of case handling and talking through some of the different gender identifiers and race. This, again, is really helpful for us to understand who our clients are and what communities we're serving. Language at home is really important, again, to indicate the groups that we're serving, and also if an individual, if someone else is needing to do work on the case, to do a translating service as well. And How did the client learn of CHA? This is helpful so we understand where and how our outreach efforts are working. There's some new ones in here. Some of the navigators are referring people to the CHA program, so it's really helpful for us to indicate how clients are sort of working in different services and different programs of the Community Service Society. So this is really helpful section for us as a program. Was client offered evaluation? We're not doing that anymore, so I would, the default, you should just always hit no, and if that changes, we will let you know. Let's see if I might need to fill in, I'm just going to put test in some of the required fields, like I was saying. It won't let me move forward unless I'm filling them in. It's helpful to always indicate did not report if, again, I'm actually going to change it. It's really helpful for us to have a gender indicator there. And I'm going to say test learned about us through an elected official. So we're going to add a case. So test is what is called now a client, and a client file is being set up for him. This is a different, so now when we have added a client, where the database is assuming that we want to add a case for this client. And it will default to CHA post-enrollment. Age is very helpful for us for a number of reasons. Some insurance programs are specific to certain ages, and also, again, who we're serving and what the needs are of New Yorkers. It will pre-populate you as the primary case handler if that needs to be changed. If you're within your agency changing client file, it's important that that's also indicated in the database just for your own tracking purposes. The language that you provided services in, and these fields here are not indicated as mandatory, but when you're closing out the file, they are. So it's really helpful if you do it at the beginning. It also is helpful because if anyone is reviewing the case, we're going to be working on the case. This indicates what kind of insurance the person has or is working, has that you're working on, and they don't have to solely rely on the case notes for that. Here is what I was talking about, how there's marketplace and non-marketplace options. If there's things that need to be added, we're always up for hearing recommendations about the database if stuff is coming up that you don't find. It's a work in progress. Here is this is all the different plans, and again, the fact that so many people accurately entered in the Empire Blue Cross Blue Shield is really what let us do that trend tracking for that particular, what I brought up before. So this is a really important field that we can help make sure that plans and products are doing what they're supposed to be doing for our clients. So this is sort of the insurance information section. Then we have the health status section. This mental illness one also related to one of the trends that I brought up in the examples. And here we want to be tracking, again, both who are our clients and what are the needs, because this field relates a lot to their experiences with the healthcare system and receiving the services that they need. Household data. This has a lot of different options, but again, it's really important that we have a sense of the demographics of our clients, employment status. Again, if you have specific questions about any of this, please do let us know at the end, or get in touch with Jonathan or Leon. You know, the non-working and disabled come up a lot if people have Social Security disability or SSI, or if individuals or parents are calling on behalf of their you know, older children who are living in the household. I'm going to sort of do the basic one. Source of income is really another field that, you know, some of this is hard to get from clients, but with time you can build trust and, you know, figure out how to ask these questions and how they really relate to what their health insurance options are, what the sort of how their coverage is working for them. We're going to just say that test is working. Income amount is extremely important because it really sort of emphasizes and indicates what programs are available for our clients. If they're eligible for MSPs or EPIC or different charity care, if they've gotten, you know, hospital bills that they can't pay. And we can also refer them to the Navigator program if they're enrolling in different, if they need insurance and need to be enrolling in certain insurance. So it helps us figure out what programs are available for our clients. So I'm just going to say that test makes $30,000 a year. If you can't get the exact amount, you can always ask individuals for a range of their income, and that also helps us figure out, generally speaking, what programs they're eligible for, and also helps us understand who we're reaching. Client's contact person, so this is if someone is calling, sometimes parents call on behalf of their children or on behalf of their spouse. People call on behalf of their spouse or elderly mother or parent. And this information have relevant backup documentation, so sometimes clients will bring in copies of their bills or their denials, and it's really important for us to indicate here that we have those on file. The outreach section is not relevant right now. We have to update that and figure out how best to utilize that functionality right now, so just don't worry about it right now in terms with the case handling. So we can save this, or if you go to needs and services, it will open date. That's the really important one that I forgot to indicate at the beginning, and I always find it helpful to use that little calendar, and it, you know, is set for today. And we can save it. And I'm just going to go through this really quickly. So this is the case view. We have the client name here, test, the ID number that has been given to the client by the database. I did not enter date of birth, which I ideally do have, the phone number. And so those two fields are really helpful to have. Here you get a sense it pulled up information from certain fields, and at opening, so right now, this is what the client's health insurance information is. Right now, the needs and services are not have not been filled in because we haven't selected those yet. That's a separate place on the database. Here, this section is always where you can either edit or close, and you'll see how those change depending on the field. If I do go to edit, This brings me back. If I notice that there's something wrong or if I want to add something that I didn't, it brings me back to this field. And we're going to, I decided we actually don't need to change anything, so I'm going to go back. If I go to client view, let me just click on this quickly. This shows the client information, the basic information for client test. It has the current contact information and nationality and language, basic demographics. And here, this is the important area. This shows the different cases for the client. And what I was saying earlier is one client might be a returning client and might have been with your organization for many years, or or just finds out about you and is really pleased with your services. So the next time they get a bill they don't understand, they come and call you again. This is where you can sort of see the case history for the client, and it will indicate whether the case is open or closed, when it was open, the date that it was closed, and that it was with your organization. You can't add a new case unless the existing case is closed. But so we're going to go into this case that we just opened. We go to the Needs and Services section, and here is where, when you are familiarizing yourself with the database, I really recommend that you click on each of these fields and read the different drop-downs. Again, we'll be working in the next month or so on updating this a little bit to make it more kind of post or marketplace relevant. But I think the different drop-downs are extremely helpful to understand where the different issue that you are experiencing or helping the client out with should fall into. In terms of selecting the needs, it's really important to indicate more than less. So if you've done a lot of work, you want to indicate all the different needs that you've helped a client with. If you don't see, or you don't, sometimes things might not fit exactly to the database, right, is to really generally that we can enter information in for each client, but it's not designed for your particular client. So we need to just use our best judgment in terms of indicating the need that we think that it is. And if you have questions, you can always ask Jonathan, or you can contact us about that. But this health insurance is extremely complicated, and the issues that our clients come to us with are very complicated, and so this database is doing its best to make sure that all of the different needs are present. But things change all the time, and people come with new cases, and so we just need to be creative in how we're completing this section. Ones that come up a lot are sort of needs, help complaining, and appealing service denial. You get a sense here of the different, it gets pretty specific. We can really nail down a lot with the database. And so it's really just spending time with this section.
I just want to add here that, as you can see, there's a need that is called needs help complaining appealing service denial, and you can select that need. That's okay. But what we cannot do is, what we can only do under that need is to advise the client about the right to appeal. So if you remember from the intensive training, that we clarify that we cannot use CHAP funding, at least right now, to represent anybody under appeals. But we can always give them information about their rights.
You can always delete and add needs as you need to. I'll do one example here about needs coverage. So if someone comes in and they need help with prescription assistance, so this is one that comes with the example that we can, and they might not have insurance, we can inform them about some of the drug assistance programs. We can add this need again and say they need to, they have a bill from when they went to the hospital, and we're informing them about the charity care program that they didn't know about. We would also select that here.
Should I drop down again?
Yes.
So here we also want to call your attention over this drop-down. These are the different options that you can select when your clients need coverage. And as you can see, there are no marketplace options. We have taken them out to prevent double dipping because, as you remember also from the training, we cannot do under CHA what we are being funded to do under Navigator grant, which is help people enroll or renew under the marketplace product. So if you, for any reason, do not find the marketplace products here, it's because we don't want to count that under CHA. Right. Just one clarification. That doesn't mean that we cannot help someone who has coverage, marketplace coverage. That we can certainly do. What we cannot do is help enroll in a marketplace coverage.
Right, and so those who have marketplace coverage are often coming to us because of problems with getting an out-of-network provider or helping with bills, right down here, helping with how does their plan work, right, or what the next steps they need to take. And we're going to be working to make sure that the needs really reflect the needs of those with marketplace products that are coming to get our assistance. This is then the services section, and this really reflects what you helped the client with, what you did to help resolve the case. Just let me step back for 1 second. For each need that's identified, there needs to be an outcome selected. Just up here, you can see the asterisk. Time spent on case. This is really important for us to know how long a CHA case is taking, or the work that you've done for a particular case. Some cases can be really quick, and others can take days or weeks to resolve. So please indicate and be accurate with that here. Amount saved is if you are helping someone. There's been some cases in the past, for example, that we were able to get an individual more charity care than they originally were granted from a hospital, and we can indicate there the difference or what we were able to save the client. That's helpful, and if you've seen the annual report from last year, I think in 3 years we were able to save New Yorkers, $13 million, and so that's really where that is getting generated from. These also have drop downs, and I think again it's just spending time with the database to find them and figure out what works, what best reflects the work that you've done. So, if we're handing out the do-it-yourself materials, which Emily will talk about, you want to indicate that here. If you've contacted a third party, whether that's calling an insurance plan or calling Social Security, that's contacted here. And often you do more than one thing for a client, and so it's helpful, to reflect everything that you've done, investigating your research. And we often, always give sort of information or advice. And then this is the section for the case notes that I was talking about before. I think for the case notes, I had already spoken about this, but what's really important is to always include the date, your initials or your name, and then the problem and the different needs, and then the outcome and the actions that you took, or the next steps that need to be taken for a case. I always find it really helpful to sort of do a big summary about what the client is presenting, and then even if I haven't done something for the client yet, I indicate what the next steps are, because we have a lot of clients and a lot of different stuff going on, and so it's sometimes we forget what is actually happening in this case, and so it's as much as you can record in the case notes what your next steps need to be, or what you anticipate is going to be happening. The case notes is really the place to do that. They should be really clear enough for if anyone who has absolutely no knowledge of the case sees the case or sees the case notes, that they can pick up where you left off. And this is in case you're not able to get to the office, or you're out sick or something goes on and the client is calling to find out what's going on, that someone else can really communicate clearly to that individual what they can expect. Emily's going to go through closing the case. I think just the main thing is really reviewing the needs, making sure that everything's been selected, completing all the required fields, and then, always if there's technical assistance that you need or questions that come up, please do feel free to contact us. So I'm going to turn it over to Emily. In terms of the PowerPoint, I just want to show, so a lot of that of what I talked about is on these slides that we will send out. And I just talked through it while looking through the database. I didn't want to read through the slides. So they're all here, and we will send this around. Yeah, so here's the example.
Okay, so we'll start with an example for a case that you have, and we'll walk through the needs and also how you would enter that into the database. So the example one, Sarah Lawrence calls your office in Albany because she received a denial in the mail from her insurance company for lab work that she received. Empire is stating that it was not medically necessary and she wants to appeal. After asking more questions, you realize that she has not done a first appeal yet. You gather some information about Sarah and you inform her of her right to appeal and give her a do-it-yourself medical necessity packet. So one thing that's really helpful that's available to you are these do-it-yourself appeal packets, and those are for first-level internal appeals. And we have a couple of different DIYs for different types of denials from the insurance company, and one of the most common is a medical necessity packet. So you're not really getting involved with the appeal. You're providing them with information on how to do it themselves and what they'll need so that they can gather all the information and sort of create a strong argument that they needed those services and that they should be covered.
And if you do that, this would count for chat purposes. It would count as just giving information to someone about the right to appeal, so it wouldn't get us in trouble.
Exactly. You're just giving them information and kind of empowering them to do their own thing.
Start again. Wait.
So in this case, we know the client's their first time calling, so we're going to add a new case. So you'll go to Add New Client, and you'll put in the client's first name. We know that it's Sarah. We want to make sure it has an H on the end. And then, we'll get as much information as possible from her, even though it may not seem completely relevant for what we're doing here. It may be in the future if she calls again. And also, you'll obviously want to get her address and phone number and email in order to send her the DIY. You'll choose county. We're going to say in Albany. And you'll ask her these questions. So we'll put in a zip code. We're not sure.
Yeah, change it to Queens.
No, let's put in Queens. Switch it up a little bit. So here you'll scroll down, and it's entered in as Queens in the database. All right, and her zip code, we'll say she's in 11101 in Queens. And then you'd put in her phone number and the type of phone that she has. Okay, so she's heard about CHA. She's walked into your office, but we'll say she got a denial, so she found out through the insurance company notice. All right, and then you can either save it, which will bring you to this screen, or you can just hit Add a New Case. Sometimes it's good to save just to make sure everything has been saved. You don't have to enter it again. Then you'd click on Add New Case, and here's where you'll put in all of her information. So you'll put in the open date, usually that same day. You'll put in her age, your name, what language you provided the services in, and you'll indicate whether or not literacy and language are related. And then you'll put in her type of insurance. So she's got a letter from Empire, and she's told you that she has it as an individual non-marketplace plan, and you'll indicate that. And then you'll put in the plan type, which would be Empire, Blue Cross Blue Shield. She doesn't have any other insurance, so you're just going to move on to the next section. She might have indicated to you that this was related to a chronic illness like diabetes, and in that case you could indicate that yes, she does have a chronic health problem, and for the other fields you would fill them out however they apply. You want to fill out, again, as many fields as possible. Okay, and here, again, this information, you'll ask her, even though it may not seem relevant, but she'll tell you. Or you can indicate that she didn't want to include that, or you didn't report it. Okay. And we're assuming that she brought in copies of her EOBs from Empire so that you do have relevant backup information on file. And you'll save. And then once you're here, you can see all the information you already entered, and you can go to the Needs and Services section. So here, you know that she has a denial. She got the denial after she received services. So you're going to go to Needs Information. So that's basic orientation. And then you'll indicate what fields are relevant here, in this case, how my plan works. And next steps. What options are available is also relevant. And then we're also going to add medical service needed. I'm sorry.
Well, most of our cases will include needs basic information.
Mm-hmm.
and an additional need.
Right. So in this case, she needs help with an appeal. So we're putting needs help, complaining, appealing, service denial. And then you'll indicate the type of service. In this case, we know it's lab. So you'll click lab and imaging services. And then the form of denial, this was written after. So it was written post-service. And then you'll select the reason. In this case, it's medical necessity. And then she doesn't have Medicaid, so we'll enter no. We don't know if the plan has grandfather status. The level would be internal because you're just giving her a first level internal appeal DIY. And then in the outcome, general information provided, because we're just providing basic information on what she should do and what her options are. Okay, and so then we'll go down to the service session information, time spent on the case, you know, indicate however much time you spent speaking with her and how long it took you to, you know, compile all the information. Right now we don't know how much was saved, so we just gave her information, so we'll just put in 0. Actions taken, you gave orientation, information, advice. You investigated and researched by looking at her EOB and what her appeal rights were. And also, you generated a document. And in this case, it's the DIY medical necessity materials. And then in the notes, you'll indicate what you did. Again, you'll put in today's date, and either your name or your initials, and then you'll detail the advice that you gave her and a little background as to why she came to you for help. And then you'll save that information. And then now we know that there's nothing else that we can do at this point. We've given her all the information she needs, and she's going to appeal on her own. So we know we can close this case because there's nothing else we can do at this point. So here we see that all of her information is here, and we'll just go down to close case. We'll click on that. And so it's always going to come up a little dialog box to let you know that everything that you had in there before is just being copied over, and you'll update any additional information and add the required fields. So here, everything we've already entered is saved, and this is where it really comes in handy to put in as much information as possible in the beginning. So when you go to close a case, it's already there and you don't have to do anything again. We're confirming that everything we selected is accurate, and scrolling down, as you can see, disability is now a required field, but we've already filled that out, as well as all of her demographic info and household data. And here, you'll come to the closed case section. You'll put the date that you closed the case and why it's being closed. And there's 2 reasons. One is that the case is completed, you've done all the work, and there's nothing left to be done at this point, so you're closing the case. Or it's a loss of follow-up, and that means that you started working with a client, there was more work to be done, but you couldn't reach them again. So you called them a few times, maybe you sent them an email, but either way, after several attempts, you weren't able to reach them, so that would be a loss of follow-up case. And in those instances, we typically send a closing letter just to let them know you contacted us for assistance. We tried to reach you and we weren't able to, so please call us back if you would like our assistance. But in this case, it's case completed. And one of the required fields is whether or not it's a story bank case, and you will say yes or no. In this case, with a simple DIY, we would probably say no. And then if it were a loss to follow-up case, you could indicate whether or not you sent them a closing letter. In this case, no. If you say yes, it usually automatically generates a Word document. That's a basic template for why a case is being closed for loss to follow-up. And you can add any additional information that you feel is important or relevant, maybe time-sensitive. and then you would send it to that person. And that's why it's another reason why it's very important to get their address upon initial intake. Okay, and here we'll verify that the insurance information is accurate. And if you have any additional notes or services, you can click on Go to Needs and Services. And it will take you back to this screen if you need to add additional needs. But we've already added what we need for this case. So we'll just double check to make sure everything's accurate, and we've selected everything we've done. And you'll go back and hit Save. And it's going to take you back to the client screen. You'll see that the case is closed and the information about that. You can either print a closing letter here, and it'll automatically generate that same closing letter. And then you can print the case if you need to keep it for your records. And just to make sure that everything's done, you can hit Client View. And now the status of the case is turned to closed instead of open. So now if the client came in for an additional need that's separate from this, you could add a new case, and their client file is already there. Okay.
I'll go quickly back to the part where it's short on time. So I want to just, again, we'll send this around. We have another example in here, so you can see what the different answer key is once we send the file around. I think that one thing just to bring up is that there are some common mistakes in terms of database entry. One is not putting in the income, not gathering enough contact information from the client, making sure that we categorize the income the right way, whether it's SSI or SSD or retirement SS. And so that's important also. And one thing that happens a lot on the helpline is the word coverage means insurance. And so any of the needs that have to do with coverage is relating to an insurance, not a billing or a medical service. And so here's just a list, and this is sort of fun. At some point maybe you can, match the issue to the need. And then there's the answer key here. But you can see, like Nora was saying, that a lot of times needs-based orientation and information is selected. And so, again, that really helps reflect all the work that you're doing, and that you're providing information that's often more contextual, right, around a specific issue that they might have about how their insurance works. And that's a really key part of CHA's mission, to help people understand insurance. So that's a helpful need to select. If you have questions about this, we can go through it, but I just thought it was helpful, some of the really common issues that come through and what we would identify as needs. Some tips you can just look at. It's really important to save information, and that you don't want to leave a file open for a long time without having it saved. And if you need to reopen a case, please contact Jonathan. He can make that happen. Sometimes clients come back, or it looks like a case with an issue that's related to that case needs to be resolved, so that's okay. And the database is really about practice. It takes time to understand where things fit, and each case that you get is different and will need different input. And so, getting familiar with where things are or how things are defined in the database really just takes, getting to know it. So really quickly, just the CHA presentations, the community presentations. When you're at the main screen, main menu of the database, there is this community presentation section, and it's pretty straightforward. You're entering the presentations by the last day of the month, and you want to use the sign-in sheet and evaluation forms that you have been provided with. And so it's an easy way for you just to record what presentations are happening, and we can just go into one. But there's, again, all of the asterisks. It's the same kind of language that is from the case handling. Anything that's with a red asterisk needs to be completed. And there are these different drop-down menus. So it's important for you to select the different issue. We'll be probably adding to some of these as there's new issues coming up. The different audience, the name, the contact person at the organization, the county. Language is really helpful for us to include, and we have to, but it's really good for us to know when we're presenting in different languages to our consumers. And should I fill these out briefly? No. No? Okay. You'll always get this pop-up if you're exiting, and it just is the way for the database to make sure that you're getting out of something and not, you're not afraid to not save it. So, oops, not sure what happened there. And those are the forms that you've been given. If you have questions, Jonathan is available. I'm also happy to make myself available. The database is a work in progress, but it is a really important tool for the work that we do. And, just be patient with it and take time. At the beginning, it will take longer for you to do data entry when you're first starting out with your clients, and then as you get familiar with it, it will, become second nature. So just trust that, and there, it is as logical as we can possibly make it right now. And thank you. So I'm going to turn it over to Leon and Nora. I don't know if questions have come in.
Yes, it does look like we got some questions. So I just want to thank Emily and Steffi for doing this wonderful training for us on the child database. What we're going to do now is that we're going to look at the questions, and we're going to do our best to address all the questions available. So the first question that came in is that, is there a manual and slide to the database? So what I sent out a email on Friday, the child update, which included the child policies and procedures, and one of the appendix was the child database manual. So the manual is there. What I can do is I can send it out as just one file so everybody can have that manual, but it was sent out on Friday. If you did not receive the child policies and procedures on Friday, just shoot me an email, and I'll just reply back with it so you can have that information. It says there was no database section to the training manual we received at the training. Okay, so the database manual was a part of the policies and procedures that was sent out by myself on Friday, so you should have received that. It says, if client does not give permission to share the information, should we still put the contact information in? So as Steffi indicated, you can anonymize clients. So what happens is that once you click that button, you can still put in the information, but after it's printed once, all the identifying information disappears. Mm-hmm. So after you print the case just once, that information goes away, all the identifying information. So that client is anonymized.
So you can also enter like a letter for like any. The important thing is that you are able to recognize that case from your case files and match it with the case identifier number. Although you can anonymize it, the demographic information is still important for us to capture, but that's not identifying information. So you can go ahead and capture the demographics even if you don't enter their name or other specific information.
Okay. Next question. What is the start date of putting in the cases in the child database? So the start date, so like let's say the client comes in today and you're starting to assist them on August 11th. That would be the start date for the case. And then the end date will be the date when you actually close the case. So some cases close the same day. Some cases close a month later, 2 months later. Just all depends on the client's needs and situations that you're assisting them with.
Now, I don't know if the question was also related to when can you start doing when are you supposed to start doing cases? So the month of July was just a month for training. So you are your baseline. You don't have to meet your baseline for July. So it would be August 1st. But if you have any cases from July that you want to enter, you're welcome to enter them.
All right, great. And Sina Nora mentioned entering cases. We ask that you enter all cases for the month by the last day of the month, so we can run our reports and things of that nature in the following month for those cases. Okay, it says, in the beginning, we were told we could help people remain in coverage if they need help renewing paper applications for Medicaid and CHIP. This isn't marketplace coverage, and navigators are not allowed to do it. Has this changed?
So far, the navigators are not supposed, you're right. At this point, the state is asking navigators not to do recertifications. But we anticipate that that's going to be changing very soon, maybe in the next 1 or 2 months. So if you have a case where you cannot help someone as with a recertification because you're a navigator, you're welcome to put it here. But moving forward, as soon as the state gives the green light for navigators to start doing recertifications, that will not be an acceptable child service. And remember, in terms of the sustainability of the program, one of the issues that we had was that the state considered that navigator was sufficient. Navigator funding was sufficient for all the types of consumer assistance services that people needed. And our big lift was proving that even after getting coverage, even after renewing coverage, people still need those post-enrollment assistance. So we have to be, if you have many cases and you have to prioritize which ones to enter into the database, please try to enter any cases that are post-enrollment very clear or that are enrollment into non-marketplace products, because we don't want any confusion about whether child is just like an appendix to Navigator, because it's not. It's really an important complement to Navigator services.
All right, great. The next question is, when do we use the educational material and promotional material links? And the answer is that you don't use that section. That section is not relevant to you right now. Next question, is there a place to reflect a major outreach event even if it does not result in a training?
I think so, yeah.
So we're going to send out a monthly outreach survey. It's going to be a survey monkey that we're going to send out at the end of the month. That's where you can indicate any kind of major outreach event that you do. Next question. Do we only send a closing letter for a loss to follow-up?
No, not necessarily. You would always send a closing letter for loss to follow-up just to let the person know that we tried to reach them. But certainly sometimes when a case is completed, you'll also send a closing letter just to let them know that the case is closing and that they could contact us in the future with any other issues that they need help with. But it's not required. But if you feel that it would be helpful, you can definitely send a closing letter.
So the next question is a tough one.
Okay. The next question is, how do you enter a small business?
So that would be under the SPAF database, and that we will train you on. You will receive an additional training on that part. Those of you who are doing small businesses, we'll send you an invitation for another lecture webinar.
Next question. There are many languages not listed on the drop-down. Can you add them, or should we select other?
So I think you can write down the name of the language, and what we do with that other field is that as we see that some kind of a language or a specific information is recurring, we can add it to the drop-down.
All right, next question. Are you providing interpretation services, or is this the responsibility of the CBL. I don't know what CBL.
Maybe. So CSS, as part of the helpline, we do have a language line, which we can make available in case that you guys need it. But you guys also, depending on the agency, you guys said that your agency was selected because of certain language capacity. So in case that for any reason you cannot provide services in a language, what we would try to do is connect that person, connect your client with the agency that has the language capacity. And if we cannot do that, you can certainly contact Leon and we'll make an arrangement to have the language line available.
All right, that's all the type of questions that we received for now. If anyone else has any questions, we have Emily and Steffi available with us for the next few minutes, and then they have to leave and return to their other responsibilities here at CSF. So if you have any final questions for them, if you can please type them in at the moment so we can get their expertise on it while they're available here with us. All right, let me check. Okay, so I see we have some additional questions that came in. Let me just go over that, and we're going to read those questions. It says, I missed the beginning. How do we access the username and password? Okay, I individually emailed everyone their username and password last week. If you did not receive an email from me, please send me an email and let me know so I can pass it on to you. Next question. Do we enter all the cases we've opened since July 1st in the database now?
So as I said, July we left it as a month for training. So we are going to start counting your baselines starting in August. If you have cases that you want to enter, that's great, because like if you have cases before August 1st, yes, enter them if you want to enter them. If you don't, it's okay if you start August 1st. By the end of the month is when we run that data, and we check if you have met your baseline. So it's very important that you enter all your information in the database, because when you send your invoice, we ask for a printout report from the database where it shows how many cases you have in the database.
All right, great. Next question. Are there any other online self-paced trainings for CHA?
So I don't know if you're asking about like other webinars, but we do have a lot of webinars on the portal. And you can go and browse around and see if you can find what you're looking for, and if not, just contact Leon. If you guys feel like you need more training in a specific topic, please always let us know, because the specialists and us at CSS, we are very interested in really covering what your needs are. So if you want a training on something, let us know. And possibly it is in the portal. And even if it is, if you want a refresher, we can do it as part of one of the monthly meetings.
All right. Next question. If a client came during the enrollment period and got insurance but did not receive the insurance card as yet, will that be considered a CHA case?
That is a tough one. I think yes. I would say yes. I would say yes.
The problem with their insurance.
It's a problem with their insurance. So you would have to say that the person has coverage already, and that's what would trigger that it's not a navigator case because the person already has coverage.
Right, and I think there's an issue that is specific to needs a card.
Yeah, and there's a need that's called needs card because we saw it so frequently that we decided to add it, although like you would think that it's like we were not making it up.
All right. Anyone else has any additional database questions while we're here? As I mentioned before, the database manual did go out on Friday. If you did not receive it, just please send me an email. I'll respond back with the database manual. We do ask that you enter all your cases from August 1st through August 31st by the last day of the month. So you definitely want to get that information in. As the ladies mentioned during the training, the more information that you put in, it's the better in terms of when you run your reports at the end of the month that you're going to submit with your invoice. And you can run different reports also in terms of how you're doing and the demographics and things of that nature as was indicated during the training by the charts that the young lady showed.
I also want to add that, so it's a clarification. All the new child agencies can start entering cases on August 1st. But there were a couple of you guys who were with us before the RFP. In that case, you will have to continue. You should have had continued your child services, and you won't have like a gap in services. So if you were one of the agencies that was with us during this year, before the beginning of this year, you will be asked to enter cases also for July.
All right, we did get one more question. It says, so cases we entered before August 1st, will they still count towards our deliverable numbers?
Yes, we will count them.
Okay, great. All right, anyone else have any questions? You can please type in your questions. I'm going to give it like another 30 seconds, see if we get any additional questions. If not, we're going to release Emily and Stephanie.
Let me clarify something then for the previous question. So let's say that your baseline is 50 cases a month, right? And you did 10 of those in July, and you're one of the new agencies. It would be convenient for you to add a note in your invoice if you only did 40 cases in August because you did 10 for July. It would be important for you to like just put a little note on your invoice clarifying why your number of cases for August was a little lower. Although like you met the baseline because we would count the cases that you enter in July.
All right, so we've gotten no additional questions. So at this point, we just want to end the training section of the meeting. So Emily and Steffi, thank you very much for putting together this wonderful training for the Child Network. Definitely useful.
Thank you.
Thank you.
Thank you.
We only have 10 minutes if people want to share.
Okay, so we did get one additional question in terms of presentations. Presentations are not part of the baseline. It is not mandatory. Presentations are completely optional. It is just like a tool that you would use in the community to let people know that you're there and that you're available to provide child services. So if you do a presentation, we do ask that you enter it into the database.
The reason why, although we are not being funded for presentations, we are still keeping track of them is because we think it might make our case for sustainability stronger. To show how many people are we reaching through community presentations. Also because we want the state to reinstate funding for that. So that's why we are encouraging people to do it. But Leon is right, it's not part of the baseline.
All right, so just want to thank everybody for coming to this section.